So I want to thank everyone for joining us this evening. My name is Aaron Cohen. I'm a neurosurgeon. I'll be starting at USC Department of Neurosurgery in less than 3 weeks, and I'm very excited to be there. I'm also very excited to have a chance to talk all of you today. So tonight, I want to tell you how much really is important to me to be here and talk to you about the topic of hemifacial spasm and clarify some of the details related to the treatment of this disease. Why am I here? And obviously, just like anything else, when we talk today, my perspective is formed by my operative experience over 21 years. I have really focused on hemifacial spasm surgery for the past 21 years and has been one of the main focuses of my practice. And because of that, I have accumulated a significant number of operative cases. As you can see, 521 cases over 21 years. That's essentially the most number of cases for a single surgeon currently in the United States. We're very proud that our cure rate has been 90%, generally is 70 to 80% in best centers of excellence. And our permanent complication has been essentially none. And I can tell you that would be the foundation of what we'll talk today, because if you want to recommend surgery early, you have to be able to keep your complications extremely low. Temporary complications has been only in 2 patients, zero risk of hearing loss in every patient we have treated. And the only 2 other patients had temporary facial weakness, and that was because the fact that they had previous surgery, and as we'll talk, during redo surgery, the risks are generally higher. 100% of my patients have returned back to their previous job. Essentially, no patient, thanks God, knocking on the wood, ever had a stroke, ever had a hearing loss, ever lost function permanently that they had before surgery. Knowing those results, I'll talk to you today about hemifacial spasm and how we can treat it. Hemifacial spasm, you all know, it's this intermittent twitching of the muscle of the face. They start around the side of the face, unilaterally around the eye typically. Spasms are triggered by stress, fatigue, or sensation on the skin like a cutaneous stimuli. And it's relatively common, 8 to 11 in 100,000 people. It's twice common in females and males. Onset is 4th to 5th decades of life. On average, the patients suffer about 8 years before definitive treatment is found. And that's going to be one of the focus of the discussion tonight. Why do patients wait for so long to get a treatment that's cure? And we're going to talk about that. If the reason neurologists and some of the family doctors continue giving Botox and don't refer the patient, because the number of surgeons who can offer a very low risk option is relatively small. And because of that, the neurologists feel like there is a risk with surgery, and therefore we should continue giving Botox, when in fact Botox can lead to permanent facial weakness. And that's not good. So you want to get the patients early to surgery, not too early. We're going to talk about when it's too early, when it's just right. If you have minor spasms around your eye and Botox is doing a good job and it's not causing cosmetic deformity, that's reasonable. But if your spasm is causing the deformity entire face, it's really cosmetically very problematic for you and it's affecting the entire face and no longer around the eye, and the Botox is causing weakness, you should go to surgery as soon as possible. The faster you go to surgery, the better outcome, and Botox long-term will cause permanent facial weakness. If you have Botox for extended period of time and stop it, your face won't come back in a majority of cases. And that's why it's important to do the surgery early on, because you don't want to have the surgery and you still have this facial weakness and facial droop. That's very embarrassing. So you want to do the surgery just at the right time. 8 years is way too long. It shows a misunderstanding on behalf of our neurologists. misunderstanding on behalf of family doctor or other doctors, because the patients have to be referred, I would say, about 2 years after the onset of spasms. That's when it really affects the entire face. It's not life-threatening, but it can be extremely stressful. Hemifacial spasms are very embarrassing, cosmetically are extremely problematic. People who have hemifacial spasm really feel like people look at them weird, as if you're winking at someone, as if you're not right, and therefore you got to get this treated on time. It is one of the most satisfying part of my profession and my career to treat hemifacial spasm patients because the results are so extremely satisfying. I cannot emphasize to your group enough, you know more than me probably, how extremely embarrassing hemifacial spasm is, how embarrassing the weakness from Botox injections are, and how it can deeply affect the quality of your life. It can lead to major depression. You can lose interest in everything in life because you're just not looking like to other people. Here you can see hemifacial spasm. Your face becomes asymmetric. You just don't look right. And it can be extremely embarrassing and very much interfere with your vision when you're driving. What causes hemifacial spasm? You all know most common is a blood vessel compressing the nerve at the brainstem, and could be related to also trigeminal neuralgia. Rarely injury to the nerve or tumor of Bell's palsy can lead to hemifacial spasm. What are the symptoms? This twitching starts around the eye, progresses to other muscles. Symptoms persist during sleep. Typically, you hear this clicking of sound in your affected side, and it can impair your vision. And as I said, the cosmetic embarrassment is significant. History of physical, MRI, it demonstrates a vessel compressing the nerve. You can see here. You often ask me, I've had a number of patients ask, okay, they don't see a vessel on my MRI. That means I'm not a surgical candidate. That is not true. There has to be the right sequence of MRIs. It has to be thin cut. It has to be a special sequence in places where surgeons really take care of these patients very frequently. And just because you had the low resolution MRI and they didn't see a blood vessel, that doesn't mean you're not a surgical candidate. Therefore, you gotta go to surgeons who manage hemifacial spasm regularly. You don't wanna have a diagnosis that is untreatable and suffer the rest of your life. One of my dear patients, you can see how embarrassing hemifacial. This is after Botox. You can see the face is extremely asymmetric. It's very deforming the face. It's not desirable at all. You can see her in another point in life because of the spasm. And after surgery, it's really amazing. It is amazing. It's really a new human being. Just to be able to have your own face back. I cannot emphasize how important that is. Treatments, medication, Botox, radiation, surgery. Definitive treatment is surgery. Medications fail. Injections fail. Radiation therapy, rarely effective ever. Surgery is the only treatment in the right hands of a surgeon. Medication, you have heard of all of this. They cause drowsiness, nausea, rash. They can cause even, dependence on these meds that could be, addictive. These medications only affect you and don't treat you. Botox, it may cause permanent deformity if you do not come to surgery on time. It can help stop minor spasms, and that's very reasonable. It induces facial paralysis. This facial paralysis, because Botox damages nerves, it can lead to permanent facial weakness. And when you have this Botox, every 3 months, you have to have another injection. And just about the second month, you'll see that the spasms slowly come back. And that can be really unsettling, that every 2 months, you see this slow return of these spasms, and that, in my opinion, is unacceptable. Radiation therapy, extremely rarely used if the patient is not a surgical candidate and its outcome is very questionable. Microvascular decompression, you have to have a correct diagnosis, safe, durable treatment. 85 to 90% become spasm-free. It's a small incision behind your ear. Surgery takes 2 hours. We remove a small bone. We go around the brain. We have developed a technique. I've developed a technique personally that can perform this operation under 1 hour with extremely good results, with recovery within 1 day. And these minimally invasive techniques, because after our first 200 cases, we analyzed every one of our surgical videos on every patient and really came together and devised a new technique that really has been extremely effective for us. Nationally, there's 5% chance of hearing loss. I would say this can be disabling as well, because if one of the ears don't hear, you don't know which side somebody's talking to you. You don't know which side they're standing. It can be disabling. Facial weakness. It can be up to 20% of patients in national centers of excellence. Not our numbers. Our numbers are significantly smaller. Again, this is not, in my opinion, acceptable. Impaired coordination can be because of stroke. Ordinary swallowing can be, but they're rare, and brain fluid leak. Surgical recovery, I would say within a week, you can go and do your computer work. And if you do heavy lifting, probably 2 to 4 weeks. Hospital stay 1 or 2 days. Headaches and nausea are very common the first 24 hours, but very temporary. Follow-up schedule about a month after surgery, and you can start taking a shower 3 days after surgery. Cure is for surgery, nothing else. Spasms, 90% of patients, 9 out of 10 patients are extremely happy they had the surgery. That 1 out of 10 still can return back to their work without losing anything. Up to 10% can develop recurrence, and a second operation can be done in select patients. If the treatment is pursued, how can you manage your spasm, manage your stress, avoid triggers, stay active, be positive, and get treatment from the Center of Excellence in Hemifacial Spasm. Life expectancy is typically not affected. You can live a full life. However, the quality of life is significantly compromised if you don't treat your hemifacial spasm effectively. Can hemifacial spasm heal on its own? Not really. Occasionally it may get better, but it will come back. So that's really the discussion today that I wanted to emphasize and tell you how proud I am to really have some of you guys from the group come to me for treatment. It's been one of the biggest honors of my career to treat hemifacial spasm patients. It is exhilarating. It is extremely satisfying. And again, I'm open for any questions you guys may have. So we'll leave about 10 minutes for questions, and please go ahead. Angelia, would you like to comment?
I think I sent you some of the questions that people had given to me.
Yes, I can bring those up. Meanwhile, if you want to go ahead and take some of your questions as well, I'm more than happy to be able to answer them. So some of the questions I hear, why me? Could I have prevented this? Absolutely not. There's nothing you could have done to prevent this. That is very clear. Does having an EMG done spasm site on the cheek help for diagnosis? I don't believe EMG can make a big difference, but some people use it. I don't think it makes a difference for you if you're a surgical candidate or not. It's the clinical evaluation. Does the MRI have to show a compression? I already answered that. It has to have the right MRI sequences in the hands of centers who do a lot of these surgeries. There are many misdiagnoses, absolutely. Someone had a chiropractic blame it on a misaligned atlas bone. I can't tell you how often my patients are misdiagnosed. Cannot be more incredible to see the rate of misdiagnosis in the United States should be so advanced or other countries. And I can tell you that a correct diagnosis is absolutely critical. And bringing the attention to the surgeon to provide the right treatment. What alternative therapies? We talked about Botox, medicine. I don't believe chiropractic therapy would be advisable. Lifestyle changes, avoiding stress. If you don't have means to have surgery, unfortunately, that's not something I can comment on just because it's a problem of the hospital charging it and not me personally. What do you think of seizure medicines that are prescribed by neurologists? I disagree with them completely. They cause fatigue, memory issues, and they tend to be quite ineffective. What about radiofrequency treatment? I don't believe that's effective, and it can be at times really dangerous as well. I don't think it's less invasive because the surgery that currently the Center of Excellence do is relatively minimally invasive in the right hands anyways. Sling versus a Teflon. That's an excellent question. Which one easier? Which one is better? It depends on the patient. There's no perfect answer for every patient. Some patients would have a better candidate in the surgery based on what we see in surgery. Teflon is better. Some patients are better fit for a sling. So you can't really say, okay, this surgeon came up with a new technique of sling. That means his outcomes are better. No. Surgeon who can offer both, that's the best therapy to have. It's not just because you just heard about sling, that means that's a new therapy that is going to have better outcomes. I have seen a number of patients who were badly hurt by the sling procedure, very badly hurt. And I have seen a number of patients, not in our center for sure, but other centers that were very badly hurt by the Teflon. So it's not just, I heard about the sling, it's new, it's better. Unfortunately, that's not how it works. Just it's because it's new doesn't make it better. My neurosurgeon does not recommend surgery for me since I already have hearing loss. Is there a chance I can lose more? It depends on the case. If your spasm is terrible and there is a chance the vessel may have not been decompressed effectively, a redo surgery is reasonable. But again, a redo surgery has to really be done by surgeons who have a maximal experience with this procedure. Redo surgery, because of the scar, has much higher risk, and it's not advisable for any surgeon to do it. Conflicting views among surgeons about whether the longer you have hemifacial spasm, the less chance surgery would help. Absolutely. The longer you go without getting treatment at the right time, there's less chance you'll be spasm free because your nerve would learn to spasm even when the artery is removed. But you don't want to have surgery too early either. I would say at least 1 year of treatment by Botox if it's just around the eye, if it's minor and the Botox is not causing significant deformity by itself, not causing significant weakness, and then if the spasm is affecting your entire face, immediately be evaluated by a surgeon. Is a second surgery riskier? Yes, but in the right hand of a surgeon, its risk is not significant more. It's not a lot more than the first surgery. What are the new procedures in the future? Hemifacial spasm microvascular decompression is extremely effective. I want to be honest with you. It has become very minimally invasive. It does a beautiful job. I really don't know if we can do better, to be honest with you. I don't know if we can do better. It's always nice to say we want something new, but we already have a 90% chance of cure. I mean, I don't know of any branch of surgery that can offer a 90% chance of cure. So just because we have been doing it and we have refined it and we have a great tool doesn't mean we have to, change it. It's already doing a great job. And hopefully, we can have more of these meetings with you guys, and I'm happy to be able to answer any questions on the call today. We'll make it short because it's already been about half an hour. I want to thank Angelia for the beautiful job she does, and she has been doing along the years to really advocate for the patient suffering from hemifacial spasm. I want to really emphasize the importance of this group, because at the end, it's having all of you guys working together to be able to understand each other and to be able to help each other get through this. That's what's so important. So again, it's been truly an honor for me to care for the patients suffering from hemifacial spasm, and care for some of you guys. With that, you can go ahead and we can spend a few minutes to ask questions. I hear that there's a question for candidates with HBP and treatment for such. Are they any considered less able with surgical? What do you mean HBP? Could somebody tell me what that stands for? Somebody asked for candidates with HBP and treatment
high blood pressure.
High blood pressure. Are they considered less? Not really. If anybody has high blood pressure, we usually can have them see a medical doctor before surgery and get them treated. So that shouldn't be a problem. Everyone I have seen doesn't understand why the spasms are inconsistent. They feel as if there is a compression, it would be consistent. Are their spasms supposed to be consistent? Why is if I can turn my head one direction and the spasms stop? If you turn your head and spasms stop, you need better evaluation, to be honest with you. That is not usual for a patient suffering from a vascular compression hemifacial spasm. So if you turn your head and your spasms change, you need more evaluation to see during turning the head what happens. You need an angiogram while the head is turning in neutral and the turning position, and be able to understand that better. Blood pressure sometimes can affect the worsening of hemifacial spasm, by the way. My MVD was done on 5/21/24 on my birthday, and my daughter's best present of my life. Thanks, Dr. Cohen. May God bless you. That's great to hear. Kathleen, I don't know if I were your surgeon or not, but I was your surgeon, Kathleen. Beautiful. Let me tell you, it is the biggest blessing to see that I could give you a great birthday present, Kathleen. And I always tell my patients that it's so important to pray for me. That's all I ask. I want to help you, but in return, I always ask you to pray for me, because the patients are so extremely happy, and it makes me so happy. So Kathleen, if you want to unmute yourself and say a few words, I appreciate it.
Hi, Dr. Cohen. Oh, you mean my vet gave me back my life, and it is just wonderful. Yes, I was there in Indy, and I had seen you, and you're just a wonderful person, and I've been following you and saw the actual procedure you did for the hemifacial. And when I met you for the first time when you walked through the door, I know you're my walking angel. I just could feel it inside. May God bless you, sweetheart.
Thank you.
I know. Thank you. And God bless.
God bless you. God bless you too. Another patient, Sherry, is asking, I had Botox for 12 years. Please don't wait to have this surgery. It's life-changing. I couldn't agree with you more. Let me tell you, it hurts me so much. Patients come in, their face is all drooping, and they are already so cosmetically affected. And I do the surgery, their spasms go away, and they're still drooping. And it's so hurtful. It is so hurtful, because we fixed the spasm, they waited too long, and now even if I fix the spasms, they have a face that's not normal. Please don't wait for that. Please don't. Go ahead, please.
Yeah.
Francis.
I have no hearing in my left ear since I was a child. My spasm is on my right side.
Yes.
I did go to one surgeon, and he said because of my situation, he wouldn't take that risk. If someone came to you with that situation, what would you do?
You know, Francis, that's an extremely good question, dear. How much spasms are bothering you?
Not all the time, but it is debilitating when it happens, and you've got no control over it. It can be, it can be upsetting. But to be honest, Dr. Cohen, I wouldn't want to be deaf. No, I'd
I
rather
know,
have the spasms than be deaf.
I know. You know, dear, thanks God, right? Knocking on the wood. I have never had a patient have had so many. But at the same time, I always worry about, God forbid,
Yeah.
could it happen? At the same time, I don't want you to suffer from hemifacial spasms.
Right.
So I think rather than saying you're not a candidate, I would say you're a candidate when you're ready.
Right. Where do you practice? I mean, where's your practice?
I'll be at USC, University of Southern California.
Right.
I'm moving there for my family reasons. I have a lot of family there. And so we have an amazing group of people there. And really, their results are excellent. But can I guarantee? Absolutely. Nobody is guarantee
No.
anything. But I can tell you the risk is extremely small. I'll put it that way. When will you be at your new location? I'll be there in 3 weeks. USC, University of Southern California. It's a private hospital, extremely well equipped for hemifacial spasm patients. We have a team that are dedicated for hemifacial spasm patients. And really, the environment, the hospital is excellent. Really high level, private setting where you can really feel very comfortable and taken care of effectively. So please remember that. Can we see our local doctor have the MRI ordered here because we have it in Illinois and would have to travel California for the surgery? We have to order a special sequence MRI. So you can have it locally. I think that's Leanne asking. My husband saw you in Indy 10 years ago at the beginning of this issues, and you recommended Botox. After this long Botox, his spasms go all the way to his chin. Today, you just convinced me to need surgery. Yeah, let's go ahead and do. Contact me in 3-4 weeks. My email is on internet. Send me an email, and we can go ahead and schedule that MRI closer to home. What type of MRI should I ask for? It's called a high-resolution posterior fossa MRI with a protocol for hemifacial spasm. And some people call it CISS, CISS protocol, but some centers may not know what that is, so we have to be very careful to get the right place to do the MRI. So what type of MRI should I ask for? We answered that. I've recently had MRI and was told my results are remarkably well. I'm not sure what you mean, Vicky, remarkably well, if you had a spasm or not, if you had found a vessel or not. Thank you, Angelia. May God bless you. Agree with that. Hi, Dr. M. My name is Kelly. Kathleen's daughter. On my 21st my mother and I's birthday, you had performed her surgery. I just want to say how grateful I am for you and what you do. My mother now looks back to normal again. Beautiful always, thanks to you, and continue living her life again, not depressed because of the new way her face looks and the way made her feel. Thank you again. Very happy to hear that, Kelly. This is why we do this procedure. Thank you, Angelia and other moderators. I agree. High blood pressure we discussed. We still can manage that effectively before surgery. Why do spasms stop for months at a time? Doesn't seem logical, actually, if there's a compression. Absolutely correct that there are periods of spasm-free. Why did this happen? It has to do because of some of the mechanisms in other parts of the brain that are compensatory, like basal ganglia or other networks in the brain, but almost always the spasms, unfortunately, come back. If spasms do not stop immediately after surgery, How long should I take for them to stop? I would give it about at least a month. I am 5.5 months out and still have them out, but not as severe. I think a redoing evaluation, Jeanette, is indicated with a repeat MRI to make sure that the compression was done effectively. Should Botox be avoided a certain period of time prior to surgery? We typically like to see you without Botox about 3 months before surgery, but not always. If I'm traveling to California to see you for surgery, does treatment need to be done prior to surgery? Usually, this is a very good question, by the way. Whoever is asking, it's AL. I don't know, that's initials are AL. That's an extremely good question. Usually, I can FaceTime with you guys. We can talk before, and then we have you come, have the MRI the day before surgery, have a medical evaluation the day before surgery, and then have surgery within 48 hours. So it's one visit. But we have to talk ahead of time so we can coordinate all of that together. So we can know that, well, you have it for sure. Then you come the day or 2 days before, you have the MRI, high resolution, just for making sure we have everything we need. If we need one, you see our medical doctors to get cleared for anesthesia. They listen to your heart or lungs and do some labs and do your blood pressure. And then we have surgery within 2 days. So usually you come in, you wait for a couple of days, you have your surgery, and then you're back home within a week. You arrive. I would say maybe a week and a half. We usually want you to stay close to our hospital about a few days, 5 to 7 days, just before you start getting on the plane. Is there a way to determine if someone has received Botox for a long period of time to avoid facial drooping after surgery? Well, if you have received Botox and at the end of the Botox, at the second month of the injection, you don't see your face coming back to normal, there's a high chance your face may not 100% come back normal if you have surgery. But again, this is a really tough question to answer. And I would say, again, is there a way to determine if someone has received Botox for too long? That everybody's a little bit different in that respect with their injection patterns, amount of the medicine used for the Botox. But I would say more than a year or two, there's a chance some of it, weakness could be permanent. How long does someone need to stay after their surgery? Beautiful question. Usually 1 or 2 days in the hospital, 5 to 7 days after surgery before they can fly home. And yes, and we'll work with you for the insurance. To be honest, I wish I could treat everybody free, but that's not the hospital policy, unfortunately. So that's something you can work with the hospital for the insurance. So I think that's a great set of questions. Hemifacial spasm, patients suffering from hemifacial spasm are some of the most intelligent, well thought out patients who really know what they're going through, and being able to treat them has, again, been one of the biggest honor of my life. Angelia, I'll let you finish. I recommend we have this recording available on Facebook for other members who were not available.
How will we find that? Are you sending a link to us to
the recording? Yes. Yeah. We'll send you a link. Luke, who is here with me right now, is going to edit it, clean it out really nicely, bring it to you, and you can. He's going to upload it on YouTube. If you can send it to me, Luke, I'll upload it on my YouTube, and we'll send them a link, and it will be available for you anytime. And then I'm happy.
Something, if I could. Yes. The person that asked about being 5.5 after surgery. We have people that report the spasm stopped up to 2 years after their surgery. Don't know why. I myself, 6 months, exactly 6 months. It was worse before it got better. Don't know why. It just depends on the surgeon, correct? Maybe.
I think an evaluation is indicated, but doesn't mean you're going to get a treatment. Remember, it depends on me talking to your previous surgeon and see what they found in the initial surgery. If the initial surgery and the MRI after surgery demonstrate that the decompression is really adequate, there's no reason to do the surgery. But there are patients who develop what we call Teflon granuloma. The Teflon can, in fact, cause the spasm. And so that is a more complex diagnosis. We don't usually offer treatment within 6 months. We give it more time. But usually I don't give it 2 years. I think that's extremely rare, Angelia.
Yeah, that one was one rare case. But quite a few at 12 months. Maybe a couple said 18, but yeah, that's one person said 24. The other thing is, one is just that not even with the MRI you want, it doesn't always come showing a compression. If the symptom is still there, you would operate, wouldn't it? What do you think?
If they have spasms and they're a year out, and it's from the first surgery, and they're really bothered by it, and I'm very convinced that these are truly hemifacial spasms, I do offer surgery, yes.
Because I had 2 MRIs, supposedly the right kind, and they were normal.
Yeah, normal is a very controversial topic. Very controversial. This is not a simple disease to treat. It takes at least 200 to 250 cases for the surgeon to really feel comfortable to treat patients with the best outcome. It really takes a long time.
Okay.
Because it's all these arts, the art of treatment after recurrent cases. When should you offer? What do you see on MRI? The radiologist can't help you because they don't have experience with this. So it really comes down to a surgeon developing that sort of a experience of how to do this procedure and how to manage the recurrence.
Okay, that sounds good. We've often had people ask, well, how many of these surgeries do they need experience with? So that's a good answer.
I would say at least 100 minimum, but there are very, very few people that even have done 100. I can tell you.
Wow.
Are we training other surgeons to do this? Yeah, yes. I have to be honest with you. I do this surgery. When you come to me, I don't let trainees do this critical surgery. I do it myself just because this hemifacial spasm patients are just very dear to me. They're not just a teaching specimen. Do you know what I'm saying? I do this surgery on myself. If you come to me, you get surgery by me. You don't get surgery by a trainee. The trainee may do the non-critical part of the surgery, just the opening, but I do the entire critical part because, as I said, these outcomes are very important to me. I take every good outcome personally. But yes, we have almost 10 people watching the surgery just to see how I do it. But the critical part of decompression is always personally done by myself.
You often get redos about somebody else's?
Yes. I would say more and more I get redos just because the experience and the talent of surgeons is diminishing. More and more these days, I know less and less number of surgeons practicing who have a good experience, a large experience with surgery. And because of younger, newer surgeons are doing this, the recurrent rates, the cases are increasing.
Okay. Well, thank you.
You're welcome. I want to thank Angelia. I want to thank all the moderators. I want to thank all of you guys for giving me the honor of being here. And I want to thank all the great patients like Kathleen who have given me the great blessing to take care of them. God bless you all and have a good evening. Thank you so much.
Thank you.